My name is Kayla and I'm from Denver, Colorado. When I arrived to Omsana, I was Stage III-A Malignant Melanoma and heading towards Stage 4 with metastases to my lungs. When I was first diagnosed in December of 2021, I found a bump on my head. It was just kind of itchy, and I had a mole on the top left side of my head that I'd never noticed before, and it was just itchy. I didn't have any other symptoms. So I had it biopsied, and we learned it was melanoma, and then from there I had multiple surgeries to do the wide excision of the primary melanoma and then a sentinel lymph node biopsy where we removed 10 lymph nodes, 3 of which were positive for melanoma, and then I started adjuvant immunotherapy after. When I had my last scans that showed that the cancer was probably progressing, I just started looking into holistic treatments and more integrative medicine. And so every single day for days and weeks, I was just Googling and researching and praying that I could find something that could possibly offer me something better than just, a surgery that wasn't curative or treatments that could probably prolong my life but not cure the disease. And so I just started researching a lot and praying a lot, and I got connected with the Heal Navigator and then a really awesome patient care coordinator that helped answer all my questions about the type of wellness that I wanted to pursue and type of therapy that I wanted to do to try and heal from heal the root cause of why this was happening. I am a nurse by trade, and so having a Western medicine background, it's kind of a scary thing to step outside of the normal course of traditional cancer therapy. And so I was hesitant and scared, but I prayed a lot about it, and I just felt a lot of peace, like a peace that I feel like only comes from above, that this was the right thing for me, and it had everything that I was looking for. And that was really like the kind of the foundation of my decision, because there were a lot of things that didn't make perfect sense, and there's a lot of unknowns and a lot of things that you just can't predict or plan for when doing something that's a little bit off the beaten path. So prayer and my faith were really like what just gave me the peace that this is what I was supposed to do and where I was supposed to be, and it checked all the boxes for me. When I arrived to Omsana, my first few days were a lot of intake things, learning my blood work and how my body might respond to some of the treatments and things like that. So, but from the very first day, we started with coffee enemas multiple times a day, supplements that were specific to me and my diagnosis, IV ozone, IV vitamin C, CBD, hyperthermia, a modified Gerson diet. There's a bunch of things, and I can't remember everything. The IPT, yeah. Metformin protocol, a lot of mindfulness and like detox therapy, like emotionally and mentally as well. So just a lot of different things that we started with on day one that we've done every single day since I've been here. I'm probably forgetting quite a few, but those are the ones that were specific to me. My understanding of insulin potentiated therapy is inducing a hypoglycemic state, which weakens cancer cells, and then following it with a low dose chemotherapy, anywhere from 15 to 25% of a normal dose of chemotherapy and glucose that are directed, into the vulnerable cancer cells. After the IPT, we work really hard to detox the body so that you don't experience a lot of the harmful side effects that chemo can have associated with it. And I've had a really good experience with IPT. Everyone here has done a really great job of pre-treating with medications so that I don't feel poorly after the IPT. I mean, I feel great after IPT. It kind of feels like a walk in the park compared to some of the therapies. The hardest part of the IPT protocol is the hypoglycemic state, which it's probably different for everybody, but when your blood sugar is, below 70 or 60 or whatever, you just feel a little lightheaded and dizzy, you get shaky, dry mouth, all things of being hypoglycemic. And that's, for me, the most uncomfortable part, but it's not bad. Yeah, it's pretty easy. Thank you. Yes, I will take this. My least favorite treatment that I forgot to include in my list of treatments is by far the colase toxins. And for me, I feel that I have a decent pain tolerance and I feel like I'm pretty tough, but they just make me feel really crummy. I get a really bad headache, I get blurred vision, I just feel achy and hot. Sometimes I get pains in my hips and my spine. Not every reaction is like that, but the coles are by far the most difficult for me. Still tolerable, and they do such a great job of, helping me with, again, pre-medications to where it's tolerable, it's just uncomfortable. But, in the setting of eradicating cancer, it's worth it. It's certainly worth it. It's just uncomfortable, which is part of this. The holistic route doesn't necessarily mean that, it's going to be a walk in the park or super easy. It's still hard, but I think in the long run, it's very worth it. I love to travel, so the idea of coming to an unknown place wasn't super daunting for me, and the process was made really easy. It was, super easy to fly into San Diego. We had a really great driver that took us right across the border. We were, from the airport to the hotel within like 40 minutes. So for me, it was really easy and pretty seamless. I do have some travel experience, so that probably helps a little bit, but it was great. I have no complaints. It's in a really great area. We love the hotel that we're staying at. It's so close to the clinic, which is really, really nice. It's like a 4-minute drive from the clinic. So getting here was very easy. I know that, Tijuana historically has kind of had a, not the best reputation, but I think a lot has changed. I would feel totally comfortable coming here by myself as a younger female. Everyone's very kind. It feels safe. It's clean. I don't have any reservations. I wouldn't go by myself downtown in a back alley in Denver, so I wouldn't do that here. But other than that, I feel like it's a very safe and good city to be in, that hopefully the reputation it had is changing. Yeah, that's probably been one of the most encouraging aspects of this whole journey, and something that I want to remember, because, I might, go back home and continue with my scans and maybe things aren't different. I don't think that's going to be the case, but I have to remember how I feel, and I feel significantly better. Like, my body just feels more clean and energized. I feel lighter. I don't feel so I had just a really deep fatigue, like brain fog, body fatigue that I couldn't get on top of no matter what I did. And so I mean, that alone, like, I feel like has pretty much resolved, which is huge, but just mentally and emotionally, I feel a lot lighter and like more encouraged, which is huge and really important in a, cancer journey. And I had a few symptoms, from my diagnosis. Like I had this upper back pain that was likely related to the tumors in my lungs that I don't have anymore. And I really don't have a cough anymore, which is really awesome. So yeah, I feel really good. The standard of care is top notch, and I feel like I have a unique perspective because I've worked in the ER for the last 9-10 years, and so and as a travel nurse, so I've seen a lot of different kinds of care all over the United States. And I think the care at Omsana is amongst the best I've ever experienced. And a lot of that is because of the people that are here. Not, the treatments are incredible too, and they're so individualized, which I think is what gives places like this such a huge leg up. Is it's not just a one size fits all, it's tailored to you, which is very unique, and I think in a cancer setting is pivotal. But the United States a lot of times can lack that, and that's, in my opinion, incredibly detrimental. So I personally think it's the best, but that's also reflective of the kind of people that are here. So there's, I'm sure, other clinics that can do this exact same thing, and that's really awesome. But when you have people that really care and they want to take a part in your healing, it just makes it that much better, and that's uncomparable to other places. So, well, I can say that I understand how scary and daunting it can feel when you have a cancer diagnosis, especially when your doctors that you want to trust at home are telling you that best case scenario, you may only have 5 years, or if this works, maybe you have 8 years. And those are really hard things to hear. Especially for someone like me who's 32 and otherwise seemingly healthy. Like, I have no other medical conditions. And that's really hard. So I think it's important for people to know that they need to advocate for their health, and that if something doesn't sit right with them, even if they have incredible doctors that they really love, but it just doesn't, resonate with them, I think that they need to pursue that. And cancer is not a one size fits all. So you have to do and research things that, might be off the beaten path that will work best for you and your cancer. And I would say, hopefully if you're a person of faith, you pray about it and you find the direction that you're supposed to go, because it could be a matter of life and death. Yes, I would just love to thank all of my wonderful staff, Dana and Rita and Clara, Dr. Diaz, Alma, for taking such incredible care of me every single day, massaging my feet, rubbing oils all over me, holding my hand, praying with me, all of the above. That's something that you don't normally get in traditional cancer care, and that's what makes this experience so much so different from many others, and I think so life-changing. So thank you all from the very bottom of my heart for everything you've done for me. I really appreciate it.